How does UNOS work for lung transplants in COPD? Imagine waiting for a new set of lungs that could change your life. How does the system decide who gets that life-changing gift? Let's break down how the United Network for Organ Sharing, or UNOS, manages this process for people with chronic obstructive pulmonary disease, or COPD. First, UNOS keeps a list of patients waiting for lung transplants. They use a special score called the Lung Allocation Score, or LOS, to decide who gets priority. This score ranges from 0 to 100 and is based on how sick the patient is and how much they might benefit from a transplant. For COPD, the LOS considers things like lung function tests, blood oxygen levels, and overall health. The sicker the patient, the higher their LOS, which means they are more likely to get a lung when one becomes available. Doctors at transplant centers regularly update the patient's medical data. This includes checking lung function, blood gases, and other health markers. Because COPD can change over time, these updates help keep the LOS accurate. If a patient's condition worsens, their LOS can go up, increasing their chances of getting a lung sooner. When a donor lung becomes available, UNOS's computer system matches it to a patient based on several factors. These include the LOS score, blood type compatibility, body size, how close the donor hospital is to the recipient, and immune system compatibility. For COPD patients, matching these factors helps improve the chances of a successful transplant. Lung transplants for COPD can involve one lung or both lungs. Single lung transplants are often done because they are safer and more available. But bilateral lung transplants, where both lungs are replaced, are becoming more common. They can better address issues like lung hyperinflation and pulmonary hypertension, which are common in COPD. The wait for a transplant can vary a lot because COPD progresses differently in each person. Some may wait months or even years. The LOS system aims to balance the urgency of the need with the chance of success. Transplant teams carefully decide when to list a patient for transplant, considering how quickly their condition might change. After the transplant, patients need ongoing care. Regular checkups are essential to monitor the new lungs, prevent rejection, and manage any complications. The transplant center works closely with the patient to keep their new lungs healthy. In short, UNOS uses a fair, data-driven system to match lungs with COPD patients based on how urgently they need a transplant and how likely they are to benefit from it. They consider medical details, logistics, and compatibility to make the best matches possible. This process helps give more people with COPD a chance at a healthier, more active life.